Dr. Cohen will be introducing him. So welcome back. And Kevin, take it away.
Hi, everyone. Where are you? Nice size group. Okay. So next we have John Monfredo. Yes. And hello, John. Hello, everyone. And so John Monfredo has worked in a variety of behavioral health settings over the years, including inpatient substance use treatment and outpatient community counseling. Currently, he works as a substance use clinician on the UMass inpatient addiction psychiatry team, overdose specialist on the psychiatry team on the medical floors, and provides counseling at the outpatient clinic. John received his MSW from Simmons University and is currently working on his Psych D at California's Southern University. His area of clinical interest is working with individuals struggling with a dual diagnosis, PTSD, and substance use disorders. He recently completed the fellowship program with the Boston Psychoanalytic Society and Institute. John is particularly interested in incorporating Stoicism, existentialism, and aspects of Buddhist philosophy in psychotherapy. Recently, he has started to research clinical applications for bibliotherapy and poetry therapy in the treatment of individuals struggling with PTSD and substance use. He is a certified logic-based therapy consultant through the National Philosophical Counseling Association and is certified affiliate with the American Philosophical Practitioners Association. This is his second time presenting at the International Conference on Philosophical and Counseling Practices. So John Monfredo, take it away on Losing My Religion, Philosophical Approaches to Recovery Without God.
Great, thank you very much. I'm gonna just share my screen right now. Okay. All right, can everybody see that now?
No.
Okay.
No, everyone's shaking their head no.
How about now?
No, chat says no. There we are.
All right, excellent. Thank you. All right, so very happy to be here presenting. My background obviously is in the clinical field. I have an interest in philosophy, but my background is in social work, and my undergraduate degree is actually in English literature. So philosophy is something that I've certainly read quite a bit, but certainly have not had any formal training in it. So my title of this presentation, I'm an 80s kid, so it comes from REM, the great poet Michael Stipe. So what I wanted to do really is to look at recovery, and again, focusing specifically, obviously, on substance use recovery, and looking at it from a perspective that doesn't get involved with with religion in particular, because this has been a barrier for a lot of people in terms of the recovery movement. One of the things about recovery is AA, Alcoholics Anonymous, is a incredible source of strength. But a lot of times, especially in my work in the past 5 or 6 years, people have been really reticent because there is a very strong Judeo-Christian approach to it. Whether that's true or more perceived, I'll talk more about that. So just to kind of give you a brief overview, I'm just going to kind of touch briefly on the current treatment of addiction, some of the complexities, what I call like the God problem in terms of it getting, in terms of people's accessing of treatment, and then talking about logic-based therapy and a couple of the different philosophical approaches to recovery. So right now, the conventional ones, these are the ones that I'm certainly most familiar with. The Alcoholics Anonymous, Narcotics Anonymous, these are 12-step programs. Cognitive behavioral therapy for individual, group therapy, and then medication-assisted treatments for either alcohol or opiate addiction, and that's naltrexone, which can be administered as a pill, Vivitrol, which is the shot. This is helps with cravings for both opiates and alcohol. Acamprosate that helps with cravings for alcohol, and topiramate or Topamax, which helps with cravings for both alcohol and cocaine. There is also methadone and Suboxone that's kind of put in that category of medication-assisted treatment. So when we talk about substance use treatment, there's a lot of complexities that gets involved in it. Just recently, one of the individuals that I was working at, who's a clinic patient, was really getting down on herself. She had recently relapsed, and and was very apologetic. We've just started working together, and I said, look, this is not easy. Recovery is not easy. I said, if it was, I wouldn't have a job, and that's the truth of it. It's very difficult, and there are a lot of different factors to kind of take into consideration. There's a genetic disposition. There's social factors, ranging, such as homelessness. There's also the stages of change. The stages of change in terms of where the person is at, in terms of their motivation. And this is actually something that I find that philosophical counseling and logic-based therapy can actually help in terms of move the person in their stages of change, because recovery is hard enough if there isn't a motivation, and oftentimes, when I used to work at a substance use treatment facility, one of my patients would say, you know what, I just can't be here anymore. I just need to leave, but I swear I have no desire ever to use again. And I would hear that, again and again, and the same person then would come in and probably about 2 weeks later. What I would tell them is, I believe them in that moment. That they have no intention. They gave them a lie detector test. They had no intention. But once they get out into the community and there's a lot of other factors, that's where things become complicated. I'm sure many of you have heard of like the disease model for addiction. Where addiction is viewed as a brain disease, and there is certainly some truth to that. There is a very biochemical component to it, but the problem I have with going entirely into the disease model is that it robs the person of any type of personal agency, where there isn't anything that they can do. You're just completely at the whims of the addiction. And an individual I worked with who was in recovery himself characterized addiction as a disease of choice. When someone is in the throes of addiction, when they're to use the slang, ripping and running, their brain is certainly hijacked, but it does get to a point where there is choice involved, and that's usually when the person has really hit their version of rock bottom. They've gone into some sort of treatment facility. They're clean and sober, And so there is some choice in terms of how one wishes to proceed. So when we talk about the stages of change, this comes from a Prochaska model, and it's the first stage is pre-contemplation. So that's where the person really has no desire to change. They don't think that it's a problem at all. To contemplation, yeah, I guess, I got a problem. To preparation, thinking about going into treatment, thinking about starting counseling, then action, actually doing it, and then maintenance, keeping in recovery. So that's just kind of an overview of those changes, and those are certain things that that I feel philosophical counseling can help people kind of move into a higher stage of that. So the other complicating factor of substance use disorders is that very rarely do I see a person who that's it. They just have a substance use disorder. Many of them, there is, comorbidities. PTSD is probably one of the top ones. Anxiety, bipolar, major depressive disorder. I mention these because, these are things that need to be treated concurrently and can complicate things. If you're not addressing the person's flashbacks and nightmares, then stopping their alcohol use or their drug use is going to be problematic. So again, these are all complexities within the treatment of it. When I talk about using philosophical counseling throughout this this presentation, and like various ways of recovering from without the means of like a religious framework, this doesn't work for everybody. There are so my own work in the in the field, utilizing some of these principles that I'm going to be talking about here, is really predicated on on the individual. So it's certainly not a one size fits all. All right, so what I talk about is the God problem. It's not necessarily that God is a problem, but it's a problem for many people who could benefit from AA. Now you may be saying, all right, so AA, why is this kind of what's the big deal? Why is this even a topic of a presentation? Recovery without God. I mean, yeah, sure. People recover without God from many different things. The reason I bring this up here is because AA really is a phenomenal source of strength. It has community. It gives people a sense of of fellowship. It gives them structure. All of these things are very important in early recovery. They also will have a sponsor. So when the person feels that, they want to drink or they want to use, they have someone to rely on. And increasingly, our society is becoming more secular. There's, 20% now don't identify as having religion. It's higher for younger adults. Some AA meetings, and there are many, many, many different AA meetings. Some of them are very, Judeo-Christian oriented. Some of them will even have the Lord's Prayer. Now, sometimes the barrier of someone getting involved in AA, it's just an excuse. It's just, they don't really want to, but this is just something that they can say. And that's certainly something that I want to address a little bit later on. There are a small number of non-theistic AA and NA groups, but the overall perception is that it's very religious based because they talk about a higher power. The the book that started the Alcoholics Anonymous book uses God frequently. So even though there are meetings that are not theistic in nature, the overall perception is that it's not, and sometimes that can be a barrier to someone getting and benefiting from what AA and NA has to offer. So what I want to kind of look at is how can we help people, whether it's helping them access AA or NA, being able to get over the, that issue or perceived issue that they have with God, or looking at other ways that they can approach recovery through, through a philosophical lens. So with logic-based therapy, I've used this with certain individuals that I've worked with. A lot of it is to identify, what are those things that start them to pick up, alcohol. And I've used this predominantly with individuals, with alcohol use disorder. I have not, just full disclosure, haven't used this with someone who's struggling, with opiates. So a lot of this work is in terms of identifying their, emotional reasoning that, they can't do something, without a drink, that they're, they're a loser. The identifying those fallacies, of, demanding perfection, damnation, and how all of these things then lead them to feel like they need to have a drink in order to cope with it. The other way that I utilize this in the past is looking at relapses and relapse, because relapse, whether or not we'd like to admit it, is part of the process. Very few people go through recovery without there being at least one relapse. What happens though is they will then get into that cardinal fallacy of damning themselves, awfulizing. This is the worst possible thing. I've thrown away all of my recovery, and then, well, if I've, I'm such a horrible person, I've screwed everything up, I might as well just go big. And then they go off on a bender, or they go off on a run. So part of my work with, with individuals, who have relapsed, is I will kind of pull in this aspect of, of awfulizing, and kind of calling their attention, to that. What I like about one of the things I really like about the logic-based therapy is it helps people not only identify those, those fallacies, but also helps them connect, to the corresponding virtues that oftentimes they are not even aware that they have. That they don't have, courage, or they don't have authenticity. And the uplifting philosophies that generally I find helpful, and the ones that I'm the most familiar with, just because I'm not trained as a philosopher, are ones on Stoicism, Buddhism, and existentialism. That's not to say that that other ones aren't applicable. Just in terms of my my knowledge, I haven't worked with anybody who has been versed in philosophy as a patient. So generally, my kind of introduction is kind of usually all that they're familiar with. They may have taken a philosophy course back in college, but for the most part, the individuals that I'm working with are not familiar with with philosophy at all. But one of the things that I've found that has been helpful is that people really have responded, to it when I've talked to them about it. So then we look at what are some ways of overcoming resistance to going to a meeting. So this is, and this can be in addition to looking at a philosophical approach such as LBT, or looking at, paths from Stoicism, Buddhism, or existentialism. So for example, using, logic-based therapy to kind of confront some of those fallacies that people have, such as, overly generalizing. All meetings are about God, or they will pigeonhole. Either I go to the meetings and get sober, or I don't go to the meetings and I just continues to use. Or stereotypes. All AA members are Bible thumpers. They're all trying to convert me. So that's so that's again one approach that that I've used in terms of looking at where are those thinking errors, those fallacies, and kind of having and working with them on terms of challenging them. Another way is I do emphasize the importance of of community and helping others, which is something that that AA has. I'm not saying that AA and NA is the only path to recovery. It's certainly not, but it is something that many people have found helpful. And in my opinion, the more resources one has to help with their recovery, the better. Another thing I will work on doing is helping the person reconceptualize that whole power greater than oneself. Because that's used a lot more in AA and NA than God is. So it's kind of looking at it. Okay, so it doesn't have to be your like the Judeo-Christian or or Muslim conception of a deity. This can be more from a transcendental perspective, like Thoreau and Emerson, looking at the universe, or even from Spinoza, in terms of God as nature. And so it doesn't. So again, trying to help people find a way that they that they can access the community and the resources of AA or NA. One of the things that I'll talk about for those individuals who really who either identify as as atheists or agnostic, and who really the word spirituality for them has a lot of negative overtones. There is like the book by Sam Harris, which is about spirituality without God. And I like this quote, which he talks about the spirituality is the reverence of the ordinary. Those experiences that take us out of ourself, are the often used quote from Hamlet. There's more things in heaven and earth than are dreamt of in your own philosophy. Although that's that can be a little bit problematic because there certainly are more overtones of the supernatural there. But the whole idea with in terms of helping people understand a spirituality is it's something beyond themselves, but it doesn't necessarily have to be theistic. And you might say, why is spirituality so important for recovery? One of the things about about addiction, and I'm speaking as a clinician, I'm not in recovery myself, but I work and have worked with many individuals who are in recovery, long-term recovery. In fact, one of the reasons for my doing this presentation really stems from what I've learned from them in terms of the importance of peer support and recovery. But it's being able to see something beyond yourself, because in addiction, it's really focused on just you. And there's usually some hole. When they talk about this, they talk about the God-shaped hole that someone is trying to fill, with their addiction. and being able to connect to something higher than themselves, to transcend the boundaries of themselves, is very important. And this so this kind of connects to looking at Stoicism. Now, whether this is something that I will introduce as part of the guidance philosophy through logic-based therapy, or if it's something that I will introduce on its own, it really again depends on the individual. There's certainly overlaps with that I find with Buddhism, and even with AA itself, the whole idea of focusing on what is in your locus of control. There are Stoic practices that can be really helpful, and there's a book that I've used some exercises from, like it's called the Daily Stoic Guide, and it has different activities for people to do, such as like they call the discipline of action, setting up helpful activities, character building ones, mentally rehearsing difficult situations. This is something that even before I was knew about Stoicism, I would do anyway, because this someone is going to come to a situation where they are at a party and there's alcohol. How do you deal with that? So being able to kind of mentally rehearse that is very helpful, and is actually part of Stoicism. There's been a resurgence of Stoicism the past 10 years. There's apps you can get, like the Daily Stoic. There are courses, books. I think Ryan Halliday, he's one of the popularizers of Stoicism. I haven't really read much on him. A lot of my readings have been more Donald Robertson, who's a Canadian psychotherapist. And in fact, actually, one of the books that he just recently wrote, How to Think Like a Roman Emperor. One of my current patients is reading, and we're using that as a way to help her recovery, because she doesn't really fall within the like AA is not something that she is certainly interested in or resonates with her. So we're using this as a modality. A lot of the techniques within Stoicism can be helpful. Cognitive distancing, which also, when I get to in terms of Buddhism, can also be is also something that's helpful. Postponement, doing an functional analysis. I'm not sure what I have for time. I don't want to make. Someone can just let me know.
Yeah, I was just going to mention that actually. So you're at about 25 minutes after my introduction. I'd say 25 to 27 minutes. So if you could wrap it up in the next
Sure.
3 to 5 minutes, I think would give us a good 15 minutes of Q&A.
Perfect. Perfect.
Great.
Thank you.
Mm-hmm.
This is just there. One of the things, if someone finds Stoicism to be interesting and resonates with them, there is Smart Recovery, which is based on rational emotive behavioral therapy, very tool-based, that kind of like looks at all types of addiction. So it's not AA, but it is a peer recovery group. I've actually gone through the training of that and have offered that when I was working in a substance use facility. There are also Stoic groups. These are not recovery based, but they do provide support, engagement with that, the Stoic Fellowship, Modern Stoicism. Another approach, existentialism, and this is something that I find I use actually a lot with my folks, even if I'm not saying it's existential per se, but the whole idea of finding meaning. Because after someone is in their early stages of recovery, they often find that they've lost a lot. How do you find meaning? And my experience is it's those individuals that have found meaning that is what fuels their recovery, whether that's involved in in the recovery field itself, a new business venture, art, creativity, but that's so important. And the other thing that I will certainly pull into is about values clarification, and how and the whole idea of bad faith when one is going against what one's authentic self is. The other approach, using Buddhist meditative approaches, and again, focusing on non-attachment, the impermanence of things, watching, like using that in terms of the cravings coming and going, not giving into them. And there are, and as an alternative 12-step group, there's refugee recovery, which is based on Buddhist philosophy. Each meeting has a 20-minute guided meditation. There are meetings throughout the country. There are also a lot of really great, meditation Zen groups for some, that I've recommended, people that I've worked with to go to as well, that they've found to be beneficial. All right, and I'm sorry I kind of had to rush towards the end there, but questions about anything that I've discussed, or anything about in terms of kind of the intersection of philosophy, recovery from a non-theistic perspective.
Go ahead, Mihail. Oh, yes.
Talking about the God problem in the 12-step approaches, you said something that's under what point that stuck to my mind: the God-shaped hole. Do you use this explanation from your patients, from your clients, to help the others cope with this false problem?
No, so I don't. That expression is actually comes from the the AA community, or at least the ones that the ones that the coaches that I've worked with. But what I will address is that there is an emptiness. There is something that they are trying to fill, and trying to identify what is that. The enormity of that, and again, it varies from from person to person. Some of them are using their substances as a way to escape from the experience of trauma. Some of them, their feelings of failure. But there is something that there's something within their life that they don't find meaningful. So when I talk about that whole is that there is a lack of meaning, of satisfaction, which the substance is trying to fill, and never does. And that's where I get into the whole idea, like the spirituality component, of it, and the importance of that.
Thanks.
Thank you both. Carol, and then Sam from the chat.
Hi. I'm curious, how deeply do you go into these philosophical systems with people you're working with? Excuse me, with your patients?
I don't go into great detail for two reasons. One, I'm not an expert in that. You know, I've read philosophy, but I'm not an expert in it. I can certainly talk to them about some of the major tenets of it. The other thing is that many of them are not really wanting to go into that that much depth. So so it really does vary. For some people, it will be having them read a book, like I mentioned, in terms of for Stoicism. Sometimes I will give people in terms of handouts, related to, for example, even though he's a Christian existentialist, but I have things by Kierkegaard, which giving to people who identify as Christian, and that I think might be helpful to them. So so there's a tiny bit of an education component to it, but I don't get into a great amount of detail in it because of the reasons that I mentioned.
Yeah, I was curious. Well, for a couple of reasons. One, excuse me, I'm losing my voice. One is that, I mean, I find the two philosophical systems inconsistent, Buddhism and Stoicism, but that's just another matter, an aside. But I have had many students who I find out are in recovery because I live in, and I teach it, a school in Boca Raton, Florida, and I'm in an area which is considered the Malibu of the East Coast, in terms of in the U.S. in terms of addiction centers and so. And so many of my students will eventually, I've come to learn as they talk to me about things, have been addicts, quote, in recovery. Many of them actually live in these places, these centers, or they're living sort of in halfway houses or something. And they're often from very privileged families, but not always. But I found that many of them are quite drawn to philosophy. I've only had one student that I knew well who, and I mean, I don't ask them about themselves, but this invariably comes up if they come to my office hours. And is that they're very drawn to philosophy. I mean, it can take them in. And I think that one thing that's interesting is to note that one important area in philosophy, and there's a lot of writing on this, is that, and I've actually used this in my moral problems class, is the question of, is addiction a disease? I mean, that disease model, or is it a moral problem? And because, there are these two approaches, but it seems to me that there might be a middle ground. But usually, they see it but what I wanted to say is that even if it is a disease, which, you seem to be, I think, agnostic about, it doesn't mean that they don't have autonomy or free will with regard to it. I mean, just as someone who has, say, COPD, okay, or diabetes, they might like smoking, but, they still have to refrain from it, or they might love alcohol, but and say for the diabetic, alcohol is deadly. So some people can, choose, some people do choose to restrain themselves. And so, there is a case in which agency can enter into the disease model because a disease has to be managed.
I agree. I agree completely, and that's where when I was talking about the whole idea of the disease of choice, it is that middle ground. Because if it was just a disease, there would be no power. Nobody would recover. But people are able to recover. And there is agency, and that's one of the things that that I think in terms of getting people to recognize that there are things that they can do. I have a woman who I'm seeing right now, and it's, you mentioned, in terms of the, someone with diabetes or COPD. I met her first when she was in the hospital, and she was completely jaundiced, or her liver is failing. And she has been over a year and a half clean and sober. She completely changed her life. A lot of stressors in her life, loss of housing, lack of, family support, but she made that choice, and is doing things that are enforcing her choice. So that's where I agree with you. Yeah.
Yeah, I was going to say, so that even if it is a disease, even if it is genetic, even if one has, I mean, first of all, not all genes are switched on, and they can be switched off. But the thing is that even if it is genetic, even if one has a very strong propensity towards it, and even if it is a disease in the way that COPD would be or whatever, choose your favorite, it can be managed. I would say.
Yes.
So I think that agency can be used on either, and any of the models that you've presented. I mean, I see you as having presented 3.
Yes.
Is that right? Do I have it? Yeah, I just wanted to get clear. Okay, thank you.
Yeah.
Thank you very much. Interesting.
Thank you.
Okay, just from the chat now, we have Sam Zanayich and then Antonio in that order. From the chat, and just one hand just went up. I'm fairly certain that's going to be it in terms of time, but we should be able to get through everything, I believe. So go ahead, Sam, and then Antonio.
John, just a quick comment. I've never worked with anybody who's addicted, and I never would, unless I go on for my master's in healthcare. But I have talked to people who have problems with sort of self-esteem issues and being doormats and things like that. And I actually bring forward a couple of Kant's categorical imperatives that are often overlooked. The last 2, the formula of autonomy and the formula of the kingdom of ends. And in there, and I don't have the text in front of me, but in there, it kind of a paraphrase is that he encourages people and says that we should see ourselves as sovereigns over our life. I mean, and to me, that sort of is a nice way of sort of letting someone know without bringing in God that they are, in fact, in charge of their lives and that they're responsible for their decisions.
Yeah, no, that's great. Yeah. Thank you. Oh, did someone,
I think Antonio is next. Is our chair gone? Maybe?
Yeah, I was waiting. I mean, just this. First of all, thank you for the presentation. It was really enlightening for many things. And just a quick curiosity, because you quote you were talking about the Stoicism, and it is really powerful for, I suppose, for these kind of things. But Stoicism is indeed an ocean. I mean, in which you can dive. It got lots of things, and besides the main idea of the limits of what you can control, there are different paths in it. It's like Zeno, for example, says like a happy life is the one lived in accordance to nature. So it's something that points out more to the idea to find a resonance with the word. So as you were saying, like in a non-theological perspective, it's like not necessarily without taking gods. But besides this, there is also strong emphasis on the personal realization. We could say on what the power of the single person can do. Like Seneca, quoting the phrase of Stilpo, it would say like omnia mea me comporto. It's like everything that it's mine, I bear it with me. So from your perspective, the use of Stoicism in the context of recovery points more to highlight a non-religious connection with the word, or points more to the possibility of self-reliance?
It's more in terms of living in accordance with in terms of of one's nature, looking at what can one do. The problem with the self-reliance, and I certainly don't want to to take someone's autonomy away from that. But it's very tricky with recovery, because recovery is something that's really flourishes in a community of some sort. And again, it doesn't have to be AA or something like that, but it's something that when someone thinks, oh, I got this on my own, invariably they will fail. So that's so that part of it I don't really focus too much on, because it's very easy for the person to then just say, oh no, I can do this on my own. I'm able to do this on my own. And you know, in my clinical experience and experience talking with others, that's not the case for recovery.
Guy, great. Thank you for the answer.
Thanks. I can't hear you.
Sorry.
Sorry.
Sorry about that. So as I was saying, we are 1 minute over on time in terms of the schedule. So if these last two questions can be quick, that'd be appreciated. Antonio, I'm sorry, Guy, and then Raja. Guy? Guy, are you there?
We can't hear you. I can see your lips move, Guy, but we can't hear you.
Hi, can you hear me now?
Yep.
Yes.
Hi. Okay. So sorry for that. Yeah, I'll be quick. I just wanted to say thanks, John. I really enjoyed your presentation. I'm actually doing a similar presentation tomorrow, so it was really nice to hear your point of view. I also particularly liked the part about the God problem in the recovery movement, because I think it is a significant problem for many people as a obstruction for recovery. And like you, I think philosophy and a philosophically orientated approach and pathway can be an additional pathway within the whole movement for people that do find the more theistic, religious orientated routes inaccessible. So I think there's a huge need for that, and a lot of work that can still be done in that area, providing more philosophically orientated routes. And ironically, I would say that AA is fundamentally a philosophically orientated approach, even though it uses a lot of theistic languages, because there's, you know, pragmatism and all sorts of other philosophies influenced it. Yeah, so in short, really great presentation, and I think it was spot on. So I really enjoyed that.
Thank you very much.
Very good. And Raja?
All right, very quick then. I thought that there was sort of two different kinds of problems going on also in the discussion. One is sort of the idea of autonomy, where, you know, I think Sam's comment came in, right? The categorical imperative freedom is, you know, the freedom to give yourself norms and, you know, rules and live by them. And the other was the God-shaped whole, right? Where you said, the way you phrased it, was there's sort of this sort of huge aspect of meaning that's all of a sudden gone, and it doesn't seem like there's any necessity for one to think that the connection that's missing there, or the meaningfulness that's missing there, would have to be provided by something like God, right? I mean, community itself, and that seems to be something that you were stressing too, is the key, and of course. Or can be one key, and AA provides these rituals and these steps and so on. But, you know, none of this is sort of essentially related to religion, right? I mean, connection can be to the other, to the world, to a task, or something like that, right?
Absolutely, and that's, you know, and that's, I think, one of the big things about AA is just as you indicated, that importance of, you know, of community, connecting with others.
All right, great. Thank you, John. Very informative. And I'd also say that the Q&A is also very interesting. Okay, so moving forward then, our next speaker is Dr. Ivan Guarjardo. Right? And Dr. Ivan Guarjardo is Associate Professor of Philosophy in the College of Liberal Arts and Social Sciences at Virginia West Community College, where he also serves as the faculty sponsor for the Philosophy Club and the Human Rights Club. Ivan is published on free will, some negative effects that social media is having on critical thinking, and the importance of self-love for achieving well-being. Ivan became a certified logic-based consultant the summer of 2020 and recently opened Quest Logica, which offers LBT advice on moral dilemmas and philosophical workshops. Okay. And today he's presenting on how logic-based therapy can help with envy. Dr. Guarjardo?
All right, Cliver, thank you very much. Thank you very much for inviting me. Thank you, the organizers, Dr. Elliot D. Cohen and Sam Sinai for continuing this tradition, and Cliver for mediating the presentation. I appreciate it. Yeah, I want to talk about envy today, and just want to give you a couple of reasons. I'm gonna have a little presentation. They've been hearing from friends and from family members that they, social media is, for some reason making them more envious, right? And so I started reading some of the research about whether that was really true or not. And it looks like there is some, effects in that direction that social media is having on people, right? And I haven't never thought about envy much myself. I mean, and so I thought that, well, how would a philosophical practitioner help someone that, if somebody were to come to me and, confess that they were feeling envy and they were dealing with envy, how would I actually help them? I mean, so that's one of the reasons. The other reason is that, I opened this practice called Quest Logica to try to, provide logic-based services to people. And actually, one of my first consulees actually was experienced a form of envy, and so, but it was very hard for me to pinpoint, the type of envy that he was or that this person was feeling. And so, and also, I wasn't very, very pleased with. I mean, at least in the Western European tradition, there is a whole tradition of thinking about envy, most within philosophy and theology, and so and it tends to that tradition, at least certain strand within that tradition, thinks of envy in very negative ways, sort of like it's a bad emotion, something to be ashamed of, and even within certain theological traditions, it's one of those cardinal sins. But when I was reading the research in psychology and also some recent work in analytic philosophy about the concept of envy, and as well as some of the things that I was experiencing myself, the forms of envy that I'm encountering don't quite fit necessarily this picture of envy being bad, or being, or implying malice or ill will. And so I was trying, so that kind of triggered in me the question, okay, is there a better conception of envy that makes the right distinctions, that acknowledges some positive and negative forms of envy, and then how can logic-based therapy, which is the modality of philosophical practice that I'm currently using, how it can incorporate it into its framework. So this is my attempt to try to do so. I'm going to try to see how logic-based therapy can incorporate what I consider to be a much more nuanced and much more complex conception of envy. And so I'm going to mostly focus on, the emotional reasoning and how to represent it logically, and then talk about some fallacies, and then some, just briefly discuss some possible, some of the corresponding virtues. I'm not going to talk much about antidotes. I mean, I don't have time to do that. But I mean, if people want to ask questions about it during Q&A, then we can discuss that. So let me start by asking, let me open up my screen here and show you the presentation that I have. And I want you to think about the following example, which is, I'm going to start by trying to differentiate, envy from jealousy, even though there's a lot of overlaps between them, by following the following example. Consider the following case, right? Bobby failed to get promoted by Ray, the owner of the business he works for, who promoted Norman instead. Pained by his perceived disadvantage, Bobby plans to bring both Norman and Ray down, and in particular endeavors to destroy Ray's happiness. He makes Ray believe that his girlfriend is cheating on him with Norman. Ray falls prey to strong jealousy and tries to kill his girlfriend. He goes to prison on attempted murder charges. In the meantime, Norman forces Bobby to confess what he has done, which he does. The company fires him and he leaves town. Now, I want to make several claims about here, about this example, right? I mean, first of all, I want to say that, Bobby is envious of Norman because he perceives him as most fortunate than him. He's angry and resentful at Ray for favoring Norman over him, although he may be envious of Ray. Ray feels jealousy towards Norman because he believes falsely that Norman is having an affair with his girlfriend, right? So that's how I want to interpret this example. And so there's a difference between envy and jealousy, right? But let's start with some of the similarities, right? I mean, and so that I've been thinking about. The first similarity between envy and jealousy is that both have a tripartite structure, right? First, you have the subject of the emotion, what I'm going to be calling the subject. And then you have the target of the emotion, which is what the person or object the emotion is directed at. And then you have the good in virtue, which is the object in virtue of which the subject feels the emotion towards the target. So that is a similarity between the two. I also want to claim that both envy and jealousy are aversive emotions. They're unpleasant to experience, and sometimes they are, they're very painful to experience. So they're aversive in the sense of the term. There is also, they both involve an element of social comparison. It's sort of like where the subject compares themselves to the target along some, along some relevant dimension. And so, although that's not always the case with jealousy, I mean, you can be jealous about possessions that you have, material possessions. You can be jealous about very abstract entities like the government, and you're not necessarily socially comparing themselves to them. Although I am going to claim that envy does involve social comparison. You're comparing yourself to the target and then feeling this aversion in virtue of this social comparison. And then I want to say that, both of them are competitive or rigorous emotions, right? They happen in contexts in which one is competing for, or at least sees oneself as competing with someone, or someone may be a rival in some way, right? Supposed to be like more filial emotions, right? So these are some similarities, and that's why often sometimes in language we use the terms interchangeably to convey jealousy, to use the word jealousy to when we're really feeling envy, especially when we're feeling more acceptable kinds of envy. And so these similarities makes people sometimes think that they're not different. But despite the similarities in the part, despite there being some ambiguous and hybrid cases, I think the two emotions are different. I mean, and so what is the core? So there's several differences, but in the interest of time, let me just focus on this core difference, lack of laws. I mean, and by quoting anthropologist George Foster, who argues that envy stems from the desire to acquire something possessed by another person, while jealousy is rooted in the fear of losing something already possessed, right? So the idea here is that envy is an aversive reaction to a lack, while jealousy is an aversion reaction to a potential loss, right? The fear of loss that is going on there. Okay, so Okay, so there were some similarities, but also the core difference between envy and jealousy. I just wanted to kind of throw that in there in case people are thinking about them in ways that I don't want them to think about. So now let me focus on envy, right, which is really the emotion that I want to characterize and philosophize about. And the literature in psychology and some philosophers, they argue that that envy, in order for envy to happen, in order for someone to experience envy, their four conditions have to be in place. On the one hand, I already mentioned one, is that there's got to be an aversion, right? I mean, envy, for the emotion to be, envy, it has to be an unpleasant, if not outright painful emotion, right? It's not a pleasant emotion. There's also the condition of similarity. The condition of similarity, what I mean by that, so envy presupposes, is a kind of outward social comparison, right, to a similar other that is somewhat like us in some respect, for example, in terms of capacities, endowments, values, and aspirations. We don't tend to envy people who are too different from us, right? I mean, we tend to admire them or something else, but we have to see the person as similar to us in some respect, although of course, what similarities are at play it varies from context to context. It can be very random. It could be just like we happen to be classmates for this class and the professor is paying more attention to you than me. And that might be the only similarity between, that we both students, right? Or we both grad students or something. And so, but there has to be this comparison to a similarity. Also, the good in virtue in which the subject feels the emotion towards the target has to be self-relevant. What do I mean by that? Is that the good that serves as the standard of comparison must be self-relevant. That is something that the subject cares about or sees as important to who they are, to a sense of who they are, who they aspire to be, to their conception of the good life. I mean, we don't tend to envy people for good things that we don't identify with or identify with much, and so, I don't envy golf players. I mean, I don't play golf, so I might admire a golf player, but don't envy their skills, right? That's just me, but I mean, that's self-relevance. And that's the third conception. The fourth one is there's got to be a judgment of inferiority or disadvantage. I mean, what do I mean by that? Is so the comparison triggers a perception of inferiority or disadvantage vis-a-vis the target. Right? So these are these four conditions, sometimes called antecedents to envy. That somehow they have to be there for envy to be triggered. Now, I think that these four conditions give us a very good definition of envy that I think is closer to what I'm looking for, that does more justice to the phenomenology of envy, and it's going to allow me to differentiate between four types of envy. It's a definition that Sara Protasi, analytic philosopher Sara Protasi, proposes in her recent book on envy called The Philosophy of Envy. And here's how she defines it, right? She defines envy as an aversive reaction, right, to a perceived inferiority to a similar other with regards to a good that is relevant to the sense of identity of the envier. Right? It's an aversive reaction to perceived inferiority or disadvantage, or it's a sense that one is worse off to a similar other with regards to a good that is relevant to the sense of identity of the envier, right? And so, okay, so I'm gonna use this definition to ask the following question. What is envy's emotional reasoning? Can we, because that's one of the first steps in logic-based therapy, you have to identify the emotional reasoning that may be triggered an emotion. So what could be the emotional reasoning? What is the syllogism? What would a syllogism that takes seriously this definition look like? And so this is what I came out with, right? And so the emotional reasoning of envy. So it says, if I were to perceive myself as inferior or a disadvantage to a similar other, in virtue of some good that they have but I lack that is relevant to my sense of identity, well, that's undesirable, that's bad or very bad. How undesirable, how bad, how very bad that is depends on all the factors that I'm going to introduce later. And he also going to determine, what sort of envy the person is particularly feeling, what type of envy. But this is genetically speaking, something like this, right? I perceive myself as inferior or a disadvantage to a similar other in virtue of some good that they have, but I lack that is relevant to my sense of identity. That's undesirable, bad, or very bad, right? So that's the emotional reasoning. Now let me make some remarks here about that to move on to the next big idea that I want to introduce. The next theme that I want to introduce is that some scholars claim that envy is morally and prudentially bad because they believe that it implies malice or a bad will. I mean, not all scholars, not all people think that, but there's a tradition that does this. It is also commonly assumed that envy always motivates the subject either to level up, so level up, try to achieve the target's level, right? Try to obtain the good and achieve, resolve the social inequality by achieving the target's level, or level down, right? If they see that they cannot get the good somehow, well, I can, I can just pull the person right down to my level, right? And so bring the target down. So level up or level down. But here's what I want to say about this way of thinking about envy. I think this is not true of all forms of envy. So what is the point here? So how does that relate to the emotional reasoning of envy that I just presented to you? Well, if we want the emotional reasoning just given here, being presented to you, to be more informative, to be able to indicate to us what sort of particular envy the economy is feeling, and then be able to target responses to that particular type of envy. We need to link it to the variables that give rise to four different types of envy. And what are those four types of envy that I'm talking about here? Well, these are four types that are also identified by Sara Protasi, the philosopher that has influenced me the most on this issue. There, on the one hand, you have emulative envy, then you have inert envy, you have aggressive envy, and you have spiteful envy, right? So let me start characterizing emulative envy. I mean, but before I do that, I don't think that there is, absolute sharp demarcations between these species. They're part of a spectrum and they can blend in interesting, confusing ways. But I think they are distinct in they can come on their own. And so, okay, so let me characterize emulative envy. And so I'm going to characterize it by giving you what I consider to be a paradigmatic case of emulative envy. And I consider the case of Ernesto. Ernesto is an assistant chef at a French restaurant. He envies his colleague, Marta, the main chef, because he perceives Marta to be more productive and successful than him. Ernesto values being a good chef for his own sake, right? Being a good chef is part of who he aspires to be. Marta is a role model for him. Ernesto can see how Marta's achievements depend on hard work, not on some innate or mysterious talent for creativity. So Marta becomes a constant motivation, for Ernesto to do better, to improve himself. Sort of like sees her as someone to emulate, not a rival, right? The relationship is cordial, even friendly, and Ernesto is happy to work with her. Okay, so that's the case of emulative envy, right? And so now, if we couple the emotional reasoning of a person experiencing envy that I just showed you with the following two assumptions. First, Ernesto, or the subject of emulative envy, cares more about the good for his own sake. That is, right, not for his own sake, that is independently of the fact that the target has it. This is what some philosophers call the focus of concern, which is not the focus of attention. And the focus of concern is a normative term that tells you what the person really cares about. Do they care about the good, or they care more about the fact that they're being disadvantaged by certain other people, right? So that's the focus of concern. So Ernesto cares about being a good chef for his son, for for his son's sake, that is independently of the fact that Emma is also a good chef. That's the focus of concern. But imagine also the second assumption. So the subject, in this case, Ernesto, feels confident they can get the good, right? They say, if I work hard, if I apply myself, if I practice, eventually
You
I
don't have
can
the
get.
Vitamix anymore, do you?
Yes.
Oh, you still do?
Yeah.
Oh, all right, then that's why you kept this then.
Okay, so if the subject feels confident, they can get the good, right? I mean, Ernesto tells himself, if I work hard, if I, develop the skills, and eventually I can rise up to her level, right? So this is what in psychology and the research, the empirical research I was reading, sometimes it goes by the name of control, how much control the person thinks they can have over the situation. But in philosophy, some philosophers call it the perceived obtainability of the good. I mean, to what extent the subject feels they can actually get the good for themselves, or to what extent they don't feel confident they can get the good. Of course, that depends on the nature of the good. That may depend some facts about the person, about their context, a variety of different situations we can discuss. But suppose that you make these assumptions, and suppose that you realize that the consulee that you're trying to help, they satisfies these two assumptions, then that emotional syllogism that I show you is a case of, I would argue it's a case of emulative envy. So you get emulative envy, which implies that the subject perceives their situation as undesirable, yet they are likely to be motivated to self-improve. Right now, what am I going to say about emulative envy, and what should philosophical practitioners do about it? So here are some thoughts here that I've been thinking. So emulative envy, is mildly aversive, does not imply hostility or malice. This is how the distinction between that all envy is bad, or even the distinction between benign and malignant envy doesn't really capture. And so we get a case of emulative envy, which emulative envy is mildly aversive, does not imply hostility or malice, and motivates the subject to level up. It can be prudentially good, if self-improvement occurs, right? I mean, if Ernesto says, motivates Ernesto, and there's a lot of research that shows that actually envy motivates more powerfully, this emulative envy, than actually inspiration. It's a painful kind of motivation, but it motivates people. He gets motivated to improve, right, and to kind of get to the level of Emma, right? And so then it could be prudentially good. And even some people have argued, I'm not sure about this, how I feel about this, but some people argue they can be even virtuous. It could be a character strength to somebody to be able to feel emulative envy, because he may be a powerful motivator for self-improvement and so on, right? And so I'm not sure about that myself, but I just mentioned it to you. Since it is not self-defeating, it is not self-defeating, the job of the philosophical practitioner may only be to help consolidates understand it and dispel any guilt or shame they may feel. So you can imagine someone who still feels guilty about this emulative envy, even though there is no malice, there is no ill intention. They also feel happy in some, for the other person doing better, but they might feel guilty, or they might feel shame or something, because they live in a society that's telling them that all forms of envy are sinful and shameful, or something like that. So you might have to deal with that. But I mean, and that's not the kind of envy that concerns me more. So let me move on to what I'm going to be calling inert envy. And let me give you another a paradigmatic case of inert envy. This one is taken straight out from Sarah Potasi, but I just changed the names. But so I'm quoting here straight, for the most part. Consider the following case. Irma has been struggling with infertility for years. Irma values having a biological child for its own sake, and she's motivated to have one. However, she has tried unsuccessfully to conceive for years. One day, her dear friend Petra tells her excitedly that she's pregnant. Irma congratulates her, faking enthusiasm, holding back tears. She feels an intense envy that she cannot confess. And even though she would never wish Petra ill, she cannot bring herself to see her as much as she usually does. She invents excuses, does not go to Petra's baby shower, and overall withdraws from the relationship. Irma cannot genuinely rejoice for Petra's happiness. She's having a hard time. And of course, she feels guilty about that and self-loathing. And you can imagine some of the self-flagellations that may be going on there. And she hates herself for that. Only when she finally gets pregnant herself, Petra can connect with her friend, right? I mean, and so this is what Sara Protasi calls a case of inert envy, which, okay, so how does that connect to the emotional syllogism that I mentioned earlier? Well, so assume instead, right, that the consulee you're trying to deal with, they care about the good for its own sake. That is independent of the fact that the target has it, right? So their focus or concern is on the good, not on the target necessarily. I mean, and so this woman cares about having a baby, right, for its own sake, right? I mean, and so that a baby that is biologically connected to her, to have a family of her own. But assumes that she lacks confidence that they can, that this person lacks confidence that they can get the good. So they, for some, for a variety of different reasons, they don't think they can get the good. They're not confident they can obtain the good, right? So then you're probably going to get a case of inert envy, which implies that the subject thinks that their predicament reflects very bad on them or their life. And as a result, we tend to act inertly in a passive aggressive way. At least that's typical of inert envy, that people try to express it in this way. Let me make some remarks about inert envy. Inert envy is very painful. The subject often feels guilt, shame, and feelings of inferiority. He or she does not harbor malice, but may engage in passive-aggressive behaviors to express their aversion. For example, gossiping, backbiting, and half-hearted compliments. They may also find themselves feeling relief if the target loses the good. Although this is not necessarily Schadenfreude, which is the taking pleasure in somebody else's misery, but it's a kind of mild sense of relief that they don't have someone that reminds them of what they consider to be a flaw, they consider to be a limitation of some sort, an important limitation in their person or in their life, right? So inert envy is not necessarily morally bad, in the sense that it doesn't necessarily imply malice of ill intent towards the target, but it's certainly prudentially bad. As Sara Protasi explains, quote, self-handicapping is a defining feature of inert envy. Its structure is, in other words, self-defeating. It aims to achieve something that it presupposes to be unachievable. Now, what are some of the cardinal fallacies of inert envy? And I've been thinking, trying to wrestle with this idea, and this is what I suspect myself. But you're welcome to raise objections against this. But there seems to me that there's a perfectionism going on. When somebody's experiencing an inert envy, it's just kind of demanding unrealistic expectation of self, life, other, or the world. Right. And so, or, there's a kind of apholizing as well, that, reasoning from bad to worse, that prevents them from, responding more creatively to the situation sometimes. And there's could be a constipation, right? The failing to respond creatively to challenges, but refusing to let go of emotional, behavioral, or volitional I can'ts. In fact, you may be able to see these fallacies at play if they exist, right? I mean, and so in the following more extended reasoning of inert envy's reasoning, right? I mean, so that I'm showing you here in the slide. So imagine the inertly envious reasoning as follows: if I believe something is important to me, then I must have it, right? This kind of, I must have it. I must be able to get it myself, or life must give it to me, or the world. It's a kind of perfectionism. X is important to me, ergo I must have X. If I must have X but fail to do so, This means I or my life is inferior to those who have X, unless I can get X. I must have X, but cannot get it, right? Because they don't believe that the good is obtainable, and you have to, move them away from that mentality. Ergo, I or my life is inferior to those who have X. If I or my life is inferior to those who have X, and someone who has X reminds me of it, I will resent them. Why reminds me of my life, right? And so there's a whole, reminds me of my life. She got pregnant, she's about to have a baby, and I've been struggling with that, or some other case. Ergo, I resent why. Right? So that's the inner envy. And now,
if I may, I don't mean to interrupt. Just in the interest of time, you're at about 28 minutes. And I'd like to get a couple of questions in if we can, okay? Just to let you know.
Definitely. I think I have about 5 more minutes, and I can, 5 more minutes for the presentation, if you don't mind.
Absolutely. Please continue.
Thank you very much for reminding me.
You're welcome.
And so, okay, so how to tame inner envy's wings monster, right? I mean, so to overcome these irrational thoughts, the subject must make peace with imperfection. Right. And so making peace, living in a world where one cannot always get everything one importantly wants. The virtue of self-respect may become relevant. And it's a kind of non-defensive willingness to see and accept self as it is, regardless of limitations or shortcomings. The courage, maybe they may have to, learn about the virtue of courage, or remind themselves of the courage they already have, standing firm and responding creatively despite fear. And self-control, it's a kind of rational management and responsibility for one's emotions, behaviors, and volitions. So that's what some thoughts about inner envy. Let me introduce aggressive envy. So consider the following case, a case of aggressive envy. So Arthur is a professor of English. He envies David, who is his main rival. Both teach in different universities, but Arthur resents the fact that David works at a more prestigious university, which he feels gives David an advantage over him. Arthur believes that stealing the job from David would turn the tables. He's confident he can sabotage David, since Davis's dean has told Arthur that he would offer Arthur the position if David were to leave. Arthur convinces one of Davis's students to seduce David. David falls for it. The university discovers the affair and fires David. In the meantime, Arthur had already applied for the job, so in hearing the news, he calls Davis's dean and gets hired. Even if he did not get the job fairly, Arthur is happy because he cared more about defeating David. So I'm going to call this Arthur aggressive Arthur, right? I mean, it's a case of aggressive envy. So imagine that emotional syllogism being coupled with the following 2 assumptions here. The subject cares more about not being outcompeted by the target than the good. They're more concerned about the inferiority or the not being disadvantaged. So the focus of concern is on the target, not so much on the good. But they feel confident they can bring down the target by literally or figuratively stealing the good. Right? So it's perceived obtainability of, so they think I can get it by stealing them from them, the good. So you get aggressive envy, which implies the subject thinks that their predicament threatens their ego, status, or well-being, but feels confident they can resolve the social inequality by sabotaging the target. Now, that's what I want to call aggressive envy. I'm going to skip to some of the things that I would say about aggressive envy. You can ask me questions about it in the interest of time. And let me just jump to inert envy, just wrap up and then open out the floor for discussions. That way I don't run out of time here. I'm going to skip some things. We can come back to it if somebody, but consider, a case of a spiteful envy, right? So in a slightly different scenario, Arthur does not think he can get a more prestigious job than David. So his only hope to outdo David is to spoil the good. So Arthur tells himself, well, if I cannot get David's job, I will spoil the good. If I can have it, then he can have it either. It's like the case of the kid who breaks the toy, right? And so because he cannot get it from his brother or somebody else. So Arthur hires a student of Davis's to seduce him. David falls for it and ends up getting fired. Arthur is happy that he brought down David, at least in quotation marks, happy in some narrow sense of the term. And so, okay, so last point. Now assume that emotional syllogism, it's coupled by these two assumptions, right? The subject cares more about not being outcompeted by the target than about the good. So there is a similarity between aggressive and spiteful envy. So the focus of concern is on the target, not on the good match. Although of course this comes in degrees, and but lacks confidence they can get the good. They cannot really steal the good, so or get it themselves, for a variety of different reasons. And so you get a spiteful envy, which implies the subject thinks that their predicament threatens their ego, status, or well-being, and feels that the only way to resolve the social inequality is to sabotage the good. Thank you very much. Gonna exit my screen so we can hopefully I didn't run out of time too much. Okay. So.
We can't hear you.
Can you hear me?
No, he's talking to me. I'm sorry. Second time I've done that. Thank you very much. We have a couple questions in the chat, one from Raja and then one from Antonio.
Thanks, Ivan. That was great. I love it. I love Sarah's work too. So this is nice. Now, my question for you is, it seems that you're distinguishing the kinds of envy in terms of really dispositions to act, right? I mean, like what kind of action is likely to follow. And that is sort of, it's interesting because it brings out a range of cases that may otherwise not sort of come into view. But sort of another typical Helm and others would distinguish, and you use that terminology, the object or the target, the subject, and the target, the subject, and what Helm calls the focus. But then there's this other element that makes the thing envy on these on many of these theories, namely the formal object, right? The characteristic evaluation that goes with it. So you have the object, the target that this emotion is directed at. You have the subject, you have the focus of concern, and you have the evaluation. That sort of went missing, and I would assume that, for instance, inert envy, emulative envy doesn't really count as envy if you, at least, it depends on how you now formulate the formal object, right? If the formal object, the evaluation characteristic of the emotion involves something like, and that is unfair, right? Or somebody, is in a better position than I am, and that is unfair, right? Then emulative envy doesn't count as envy, right? So I like this sort of dispositional analysis of the different kinds of cases. I'm just losing sort of the what binds it together, because I don't have this this formal object that other people would want to attribute to envy or to emotions.
Yeah, thank you very much. Thank you very much. I mean, I think that I try to capture the formal object there in the consequent of the formal reasoning. Okay, the consequent of the formal reasoning of envy, where I say, if I perceive myself as inferior to a similar other in virtue of some good that I want but lack, that is relevant to my sense of identity, then the rating comes in the consequent. Then it is bad, it is undesirable, or it is bad, or it's very bad, right? I mean, but part of the point that I'm trying to say here is that, unless you bring in the focus of concern, whether the subject cares more about the good or about the fact that they're being disadvantaged with someone they have, the target, right? And also you bring into bear the other variable, which has to do with whether they perceive they can obtain the good for themselves or not. Okay, then that genetic, that rating, it doesn't really help us differentiate between those forms of envy. You see, And so it's there. But, and so in the case of emulative envy, I mean, you're absolutely right that, Ryan, a very good question. There is a whole tradition that doesn't call emulative envy. They call it something like emulation. I mean, you go back to lots of philosophers, you know what I mean, that they call it emulation. But I think that, the reason that I'm calling it envy, and the philosophers that they agree with me are calling them envy, right? It's because emulation, I see emulation more like an energetic disposition to pursue objectives that one hopes to be within reach. Such a hope that stems from the fact that others that one intends to emulate have succeeded. So emulation is a pleasant experience. It's not an aversive experience. While emulative envy, it has that aversiveness to it. I mean, you are pained, you are bothered by the fact that, that somebody's ahead of you in some dimension that you care about, okay? And then, but it's, you don't see them as a rival, you don't see them as a shooting target. You also don't necessarily, rate yourself in this very aversive, negative way, and also your situation. You just see your situation as, it bothers me that I'm not as good as them. I want to be, because I care about the goods that they have. And so I'm going to emulate them. So the formal object the formal object is there in the case of aversive envy, but it's a kind of malaversion that is sort of informed by this sort of, okay, my situation is undesirable, but I have hope.
Mm-hmm.
I have hope, right? And
so, I said this is great, right? I mean, the sort of bringing out these cases by looking at the dispositions to respond, that sort of brings out an important point. I would just imagine that somebody who's in this camp, right, who wants to defend a formal object kind of characterization would say, what you're giving is not a formal object. That's so generic. It's bad, that's bad, or very bad. This is not specific for envy, right? There are other sort of emotions that have that kind of very abstract kind of evaluation associated with it. It's not specific. You're not hitting the formal object. You can carve up conceptual space as you like. There are different ways, right? So I'm not. This is not an objection. I'm just imagining somebody who was in that tradition would probably say that's not the formal object. So, okay. But you're bringing out interesting cases, so that's nice.
Well, thank you very much. I'm making a note here for myself. I really have to think hard about this idea of the formal object, right? Whether you can, but you're absolutely right. I mean, and so, thank you very much. Thank you very much for that suggestion. I'm going to be thinking hard about it.
Very good. Thank you. And next we have Antonio, and then we'll end this Q&A with Elliot, and then we'll move to the next session. Okay.
Okay, because I saw Dr. Cohen got the hands raised. If you want to go first, it's fine for me.
Either way, I thought I saw Antonio first, but I may be wrong.
Yeah, Antonio, for the sake of fairness, why don't you go? Go ahead.
Oh, okay. No, it was just to say, okay. It will be a quick question anyway. First of all, thanks for the presentation. I mean, it was really great. And you mentioned at the beginning social media as an amplifier of envy. And I absolutely agree, especially on the light of the different typologies of envy that you draft. In your opinion, this may be due more to the fact that social media are widening, we could say, the contents and the occasion of experience envy in a global context. I mean, the growing envy is the result of an infodemic that we have, or it is more of the structure of the social media itself that are changing the communication. So we could say the culture of likes, the drive to show everything to our network, the compulsion to document pics and videos, even of simple things like dish pics or selfies.
Yeah, thank you very much. I mean, that's a very interesting question, and so there's a couple of things that I can say in relation to that question. One of them, the research the empirical research that I have read, that I'm familiar with, that try to touch us on this question. It raises the question, okay, is social media, negatively or positively affecting, subjective well-being, what they call subjective well-being, when sort of self-reports about how people, whether people feel positively or negatively after social media, right? And so, and what the pattern that seems to be emerging here is that, there seems to be emerging here is that it's couple. One of them is the social media, envy presupposes social comparison. Comparing yourself to others to see how you're doing and whether you're doing well. I mean, we're social animals, like Aristotle says, and we have to compare ourselves to others. I don't believe we can transcend that myself, but there are wise and unwise ways to do it, right? I mean, and so compare yourself to others. And so social media, provides more opportunities for people to compare themselves to other people and their lives, and especially in a context in which the kinds of self-presentations the people are able to produce for themselves, are very, very photoshopped, right? They try to present, Photoshop, better versions of themselves, and that creates a kind of illusion that these people are getting better or are better, look better, or are doing better than me, right? And so there is research that shows that can trigger envy, and that has increased envy, and so better than me. And even that you can even envy your past self, because you can compare yourself to even that that you were self-presenting in this kind of self-enhanced way that doesn't really accurately represent holistically who you are and so on. And you might compare yourself to your past self and kind of envy somehow, your past selves. I mean, that's also being exacerbated in some way. However, I know, it is important to also mention here just briefly that just the amount of time that people spend on social media does not necessarily correlate with negative effects on subjective well-being and the envy, because it also depends on how people are using social media. Like the empirical literature, they make the very interesting distinction between passive and active uses of social media, especially social networking sites. So if passive uses of social media, it's like when people they don't participate, they don't necessarily post anything, they don't like anything. They just basically like, checking other people and checking their feeds and just scrolling passively. And when you engage with social media passively, you are more likely to be affected by envy, as opposed to you more actively engage with social media, right? I mean, where you actually have groups and you belong to communities, and then you post things, and then you like and comment and so on and so forth. That kind of more active engagement with social media is actually can be possibly related to well-being, and it is not necessarily correlated with feelings of envy. It is more like the passive engagement. At least this is what the research seems to be showing. I mean, and so especially research that focuses on like Facebook and Instagram and some of them, it's not clear that applies to, there's other social media now, right? I mean, and so a lot of this research has been done on Facebook, but Facebook is its own animal, right? I mean, and Instagram, and there are other social media. But anyways, those are the two things that I would say, right? I mean, about to your
thank you for the answer, right? Especially the thing that you were saying is like that you can compare yourself to another, like to the version that you're giving in the social media. It goes like the quote of La Rochefoucauld. It would say, we're so used to disguise ourselves in front of the others that in the end we disguise ourselves towards ourselves. So that's
this is kind of the irony.
Yeah, thank you for the answer overall.
Elliot?
Yeah, well, thanks, Ivan, for the presentation. I obviously I like your use of LBT to define emotions. there's one point that's peripheral to your analysis, since it wasn't your objective, and that's jealousy. And I don't see where jealousy needs to be regarding something that you're afraid of losing. It seems that something that you don't have is you can be jealous of the fact that someone has something that you lack. So it doesn't seem to me, that seems to me to be distinction without a difference there. I think where the difference lies, however, is in what one might say would be reasonable envy and unreasonable. And the unreasonables, I would say, if you look at the emotional reasoning that you tracked, which was, I think, reasonable constructions. The ones that start with the perfectionistic demands, I must have what others have, and I don't. So this is awful. That's irrational. That's the type that fuels the self-defeating, types of jealousy, that we often talk about, where the person doesn't befriend somebody because they have something that they lack, or they're aggressive in the other example. So I think when you look at the rating here of your, the intentional object there, the rating of the intentional object, in your consequent, cause there, that it's awful, horrible, and terrible, the kinds of constructive envy would avoid the demand for perfection, and it would also demand that kind of, catastrophizing. It might say, well, if this person has what I lack, then it'd be a good idea, and I really think it would fulfill me, then it would be a good idea for me to strive for it. But at the end of the day, if I don't get it, well, I prefer it, but it's not something that I must have, and therefore it's terrible, horrible, and awful if I lack it. So, I think much of what you're talking about is a distinction between the kind of envy that's constructive, positive envy, you might call it, and the other negative envy, which is, self-defeating. And you can locate the self-defeatingness of the self-defeating envy in terms of the perfectionistic demand. I think you're going to find one of those, if you trace back the emotional reasoning to its upper realm, you're going to find, that kind of perfectionistic demand at the top hierarchy of the emotional reasoning.
Okay. Thank you very much. Was that a question? Or, it's, yeah, and so, I guess, yeah, definitely. I'm gonna take those comments into consideration.
Okay.
Okay.
Well, thank you, everyone, and thank you, Ivan. So we'll move on to the next session.